Good afternoon, everyone. This is Nirav Shah from the Maine CDC. I'm joined this afternoon by Governor Janet Mills and Commissioner Jeanne Lambrew. Governor Mills, thank you for joining us this afternoon. I would like to turn the program over to you to kick us off today.
Thank you very much, Dr. Shah. Sorry, I was having trouble getting connected. Doing this on my own, you know. I'm grateful to be here, and I'm speaking to you from the Blaine House office, where I do a lot of work anyway. But as Dr. Shah and I and many others have said before, this virus is everywhere. No one is immune. No one is immune from exposure to someone with the virus, or from the infection itself, or from the impacts on our work and on our daily lives. So I'm no exception. Here I am in quarantine, as you may have heard. I was informed yesterday that a member of my security detail was considered to be a probable case of COVID-19. And that individual has now received a positive test. I hope Maine people will join me in wishing that individual, that member of my team, best of health and a full recovery soon. Well, I haven't seen this individual since past Saturday. And while we always wear masks, as he did last Saturday, and while I have no symptoms, I'm feeling pretty well, I'm taking the same steps that we advise everybody else to take when there's been exposure, close contact with someone who may have tested positive, and in this case did, quarantining and getting a test. In the meantime, I'm working away from the State House, keeping in touch with my cabinet and staff regularly, quite a few times a day, working hard on behalf of all of you, reviewing files and documents and talking with everybody regularly. And I'm also watching for any symptoms, which I'm fortunate I do not have. So I wanted to reassure people that my efforts to protect the health and well-being of Maine people continue uninterrupted. Earlier today, for instance, Dr. Shah and I and Commissioner Lambrew held a virtual meeting to continue planning for the distribution of the vaccines that the federal government says will be available shortly within the next few weeks. It's a monumental undertaking. Nothing simple about it, especially with the deep freeze requirements of the Pfizer vaccine and the double doses required of both Pfizer and the Moderna vaccines, which we're likely to get sooner. And while I'm thrilled that the distribution of a vaccine is imminent, and it could be here as early as mid-December, Secretary Azar indicated that states will be bearing part of the cost, which is a concern, especially when it comes to training public health nurses and others to administer the vaccine. So we're talking about that. Most alarming though, the federal government, it appeared to us, significantly reduced the estimate of the number of Maine's initial allocation of the Pfizer vaccine from around 30 to 36,000 to about 12,675 doses. That's enough doses for the initial vaccine for 12,675 people. Far less than what is needed for Maine and proportionally for other states as well. And while these estimates are not quite final, I was on a call the other day with Operation Warp Speed and the Vice President and Secretary Azar and others. And I asked why Maine's allocation estimate had appeared to be so severely reduced. That call, and then other governors chimed in and said, yeah, ours is a lot less than we expected too. And could you just post all of the estimated allocations for all the states in one website? We don't have an answer for that yet. But last week I wrote to the congressional delegation, our congressional delegation, about these challenges and many others in a letter that talked about and urged swift congressional action on a federal aid package. Right now, we're looking in the eye of a perfect storm, it seems to me, and other states agree. The Federal CARES Act funding is set to expire at the end of the year, jeopardizing the continued operation of Maine's COVID-19 testing sites. The availability of rapid testing materials such as the Abbott ID Now, the Binax Now tests are in jeopardy. Critical support, including expanded unemployment insurance for struggling Maine families, and direct relief for small businesses is lacking. At the end of the month, it's going to be, as you know, about 35,000 people are going to lose their unemployment insurance. All this during the holiday season, while cases rise, the number of cases, There's an increase in hospitalizations, increase in the use of ICU beds, and our positivity rate continues to climb. A very concerning perfect storm. While we're planning for all possibilities, including no relief package, additional federal funding will be instrumental to Maine's continued efforts to combat the virus and to distribute the vaccine effectively and fairly, and to chart a course for full economic recovery in the coming months and years. So I'm grateful to Senator Collins and Senator King for their work, in particular this week and last week, to put forward an additional relief package. They have my gratitude, and I sure hope they're successful. Like Congressman Golden and Congresswoman Pingree, they all understand just how important federal assistance is to our state, particularly to small businesses and to those who depend on the benefits that are running out. I hope that other members of Congress nationally follow suit and take their lead and deliver a significant, much needed relief package as soon as possible. In the meantime, let's do all we can to help ourselves, to protect our own health, the health of our loved ones, and the health of our fellow Mainers, please. Again, we sound like a broken record, but I'm here to say, wear a mask, watch your distance, and wash your hands. You know, I like to say, even if you don't believe it's true, if you doubt the advice that we're getting from scientists and doctors, don't take the chance. Why take the chance? Just do it to protect yourself and your loved ones and your neighbors and the rest of the people in Maine you might encounter. I know it's tiring. I know it's difficult. People are getting fatigued. The holidays are upon us. We want to pretend that everything's back to normal. Ho, 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 but it's not. And I also know, though, that the end is in sight. And together we will get through this. We are Maine strong. If we take steps we know that will keep us safe, we can ensure that our kids can go to school and in person and go back to the bricks and mortar schools. And we know that our businesses can stay open if we all stay safe and play it safe. We know that our healthcare workers can keep up if we all do what we're supposed to do. And our families will be able to make it through this holiday season. Please keep the faith and stay safe. Dr. Shah, I turn back over to you, sir.
Thank you so much, Governor Mills. Thank you, really very much appreciate it. And before I turn in and go into the nuts and bolts of today's public health briefing, I wanted to take a moment to discuss some of the scientific principles that are at play right now in connection with what Governor Mills mentioned in terms of her quarantine period. We've talked about these earlier on, but I think Governor Mills's experience provides an opportunity to rehash them and touch on them again. So let's start with just one of the most basic bedrock questions, which is, what is quarantine? Well, quarantine is what is used to keep someone who might have or was exposed to COVID-19 away from others. Quarantine helps prevent the spread of disease that can occur before a person knows that they might be sick if they've been exposed to the virus, even before they may feel symptoms. Folks who are in quarantine do what Governor Mills is doing. They stay home, they separate themselves from others, they monitor their health, and they follow best public health practices. I want to be really clear here. Quarantine does not mean that you have COVID. How does quarantine differ from another term that we talk a lot about, which is isolation? Well, isolation also involves separating individuals from folks who are healthy. But the key difference is that isolation is the term that we use to separate individuals who are ill, who have a contagious disease, to keep them away from others who don't. The concept, of course, is similar, both of which are designed to break the chain of transmission. The quarantine means you do not have the disease. It just means you could have or were exposed to somebody. Isolation, by contrast, is what happens when you have the disease. Governor Mills right now is in quarantine. It does not mean she's got the disease. So who goes into quarantine? Well, the folks who go into quarantine, among others, are those who have had a close contact of somebody who is confirmed to have COVID-19, which raises another question. What are close contacts? The current definition of a close contact from the US CDC and Maine CDC is someone with whom you may have spent at least 15 or more cumulative minutes within 6 feet of distance of a confirmed case. Again, it's 15 or more cumulative minutes over a 24-hour period being within 6 feet of space. That raises a companion question. Who does not need to go into quarantine? And the answer there is that someone who has not been in direct, close contact with a confirmed case of COVID-19 does not have to go into quarantine. To put a finer point on that, if you are someone who is a contact of a case, you do not need to be in quarantine. I'll say that again. Someone who is a contact of a case is not someone who is recommended to be in quarantine. And finally, why do we do any of this in the first place? Why do we quarantine people at all? And the answer is straightforward. Quarantine allows us to break potential chains of spread and transmission of COVID-19. By placing somebody in quarantine who has been exposed, we ensure that they don't possibly expose others. It's not because they definitely have COVID-19. It's a precautionary, common sense measure to ensure that they don't potentially expose it. What else happens when someone is in quarantine? Well, among other things, they get tested. As Governor Mills has talked about, she's slated to be tested. And depending on the results of that quarantine, in light of some very recent US CDC guidelines, there may be changes that are made. But quarantine at its core is to take somebody who might have been exposed or was exposed and help break chains of potential transmission. I just wanted to take a moment to review some of those scientific principles that are at play right now. Turning to where things stand with respect to COVID-19 right now in Maine. It saddens me to have to begin my public health report on a very, very somber set of notes. Since the last time I spoke with everybody, Maine CDC has received reports of 24 individuals who have lost their lives with COVID-19. We received 20 of those reports just on Monday alone, and an additional 4 reports yesterday. The individuals with whom we are aware most recently from yesterday who have passed away include a man in his 80s from Hancock County, a woman in her 70s from Kennebec County, a woman in her 90s from Oxford County, and a man in his 80s from Penobscot County. Collectively, the 20 deaths that we received reports of on Monday and the 4 additional deaths that we've received reports of just yesterday bring the total number of individuals who have lost their lives with COVID-19 in Maine to now 218. I'd like to take a moment to offer our deepest condolences to the friends, family members, and communities, all of whom have lost lives of their loved ones as part of this pandemic. As we have always done, we wish you nothing but the best as you recover from the loss of your loved ones. May their memories be with you always. Right now in the state, there are a total of 12,208 total cases of COVID-19, an increase of 232 cases since yesterday. Of those, 10,870 cases are confirmed, an increase of 195, and 1,338 are probable cases, an increase of 37. As I mentioned a moment ago, just in the last day, we've received reports of 4 additional individuals who have died, bringing the total number of deaths among individuals with COVID-19 to now 218. And in total, 9,564 individuals have recovered, an increase of at least 205. I'd like to take a second now to talk about outbreaks that Maine CDC has opened up since the last time I've spoken with you. And there are 11 new outbreaks in total just in the past 48 hours. At the landing at Cape Elizabeth, we opened an outbreak investigation after detecting 3 cases. The Biddeford Intermediate School, 4 cases. At County Village, an assisted living facility, we've opened an investigation after initially detecting 19 cases. At the Blueprints Learning Center, 6 cases. At Sanford High School, 8 cases. Those are just the investigations that we have opened in the last 18 hours. Going back the clock a little bit to the investigations that we opened between just now and since the last time I spoke with you on Monday, there's one at Community Living Association, where we are aware of 8 cases. At Half Pint Daycare, 4 cases. At the Loving in Touch Home Care Facility, or establishment rather, 4 cases. At the Presque Isle Rehabilitation and Nursing Home, 9 cases. And at the Spectrum Augusta, the cable communications company, we've opened an investigation after detecting 3 cases. I'd like to turn next to provide a brief update on where things stand with an investigation and assistance that we have been providing to our colleagues at Island Nursing Home. Again, Island Nursing Home has experienced a significant outbreak, which has been exacerbated by challenges they have had in securing staffing. Maine CDC, the Maine Department of Health and Human Services, and the Maine Emergency Management Agency have been working very closely with the management of Island Nursing Home. Right now, they have a total of 35 residents and 16 staff members who have been affected by COVID-19. I'm also sad to report that they have experienced 3 deaths associated with COVID-19 at their facility. One of those 3 deaths is reflected in the numbers that I have discussed today. 2 others, however, were just recently reported in the recent few hours and will be reflected in the numbers tomorrow. Unfortunately, the situation at Island Nursing Home has been quite a challenge. But again, I'd like to take a second to commend the leadership, not just for their preparation, but for their quick and thoughtful response after having detected the situation. We at the Maine CDC, DHHS, and Maine Emergency Management Association are working with that facility to provide infection control assistance, as well as, for example, today, supporting them in another round of universal testing across the facility. We are also working to help them secure additional staff in order to keep residents safe. In terms of hospitalizations, right now across the state of Maine, 138 individuals are hospitalized. 46 of those individuals are in an intensive care unit bed. 92 are in non-intensive care unit beds. And sadly, 19 people are on ventilators right now across the state. Just in the past 6 months alone, 206 people across the state of Maine have been hospitalized with COVID-19 or for COVID-19. And finally, in terms of where things stand with respect to testing, our 7-day weighted PCR positivity test rate right now stands at 4.36%. And our testing volume for PCR tests done stands at 544 tests for PCR for every 100,000 people in Maine. So with that, I'd like to turn things over to our colleagues in the media. Governor Mills, Commissioner Lambrew, and I are happy to take any questions. The first question for the afternoon goes to Emily Tadlock.
Thanks so much, Dr. Shah. So my first question is a 2-parter, and then I have one kind of after. Local media are reporting the death of a 39-year-old woman in Penobscot County who had COVID-19 and was considered recovered, but she never left the hospital. So my question is, why would her death not be considered COVID-19 related? Which of course leads to my second question, what's the CDC definition of officially recovered from COVID-19?
The US CDC's definition of recovered from COVID-19, which is on their website, someone can be considered to be recovered in one of two different ways. The first is that they can recover based on what's called the symptom strategy. That is to say, they can have a certain number of days that have elapsed after their symptoms have resolved, which then puts them in the recovered category. Another way that they can be recovered is through a testing strategy. The US CDC does not recommend that because we're trying to preserve testing for folks who really need it for diagnostic purposes. But Maine CDC follows the definition of the US CDC. Someone can be deemed to be recovered and have had all of their symptoms resolved, and still need to be in the hospital for other health conditions that may be related to something else that may be going on, say with a chronic medical condition. We don't make the final determination of causes of death. That's ultimately up to the medical examiner. Our approach, as is the approach followed by the vast majority of states, is to keep track of individuals who have died with COVID-19. After someone has been deemed to meet all the criteria for recovery, they are no longer considered an active case, and that's how we make the determinations of death.
Okay, my second question is about, we've heard reports of some coronavirus cases in Newport, and the town office there is now closed for health mandated reasons according to their Facebook page. And we've been getting a ton of viewers from the Newport area commenting in, questioning this. Is there any chance there's an outbreak, or is there some sort of situation like that happening there?
Well, there is an outbreak going on in Newport. It's associated with the Newport Nokomis Regional High School. And in general, what we have seen with respect to school-based outbreaks is that they are a function of community spread. There may in fact be other outbreaks that are occurring. I'm not aware of any. I can't rule out that possibility, to be sure. I'm not aware of, for example, the situation that you noted at the town office. But in general, cases that occur in the community can precipitate outbreak situations anywhere else in the community, at the town office, at the school. This is just another reminder that COVID-19 exists in every single corner of the state of Maine. There is no longer a county or a township or a city or a municipality that where COVID is not a risk. And so is it possible that there are more cases in Newport? Absolutely. Is this a reminder for everybody in Maine and in Newport to take added precautions? 100%.
Thank you.
I'm going to turn things over to Dustin at New England Cable News.
This question is either for the governor or somebody who's got the answer to it. Who's performing the PCR test that the governor is supposed to get? Is that someone from Maine CDC, or is it a pharmacy? Are you going to get a rapid test at all?
Hi, maybe I can answer. I think I can answer. I think it's a PCR test. It'll be administered in accordance with my medical provider's recommendations, whatever that is, tomorrow. Besides that, I don't know any other details.
It's not someone from Maine CDC.
No, right.
It's from your healthcare provider.
Yep.
And then is contact tracing going to be done on the security team member who tested positive?
I think.
Yes. So,
go ahead.
Sure, Governor. Sorry, apologies, Governor. The answer, Dustin, is yes. And indeed, the security team, the EPU, has already initiated that process. And as of right now, no additional members of that team are in quarantine.
And then lastly, is the timeline that we got that the governor is getting the PCR test tomorrow and quarantining until the 12th, has that changed at all since yesterday? And if the negative result comes back at some point before then, does the quarantine end? How does that all work?
So, Dustin, I assume you are referencing a very, very recent set of changes that the US CDC has, a set of guidance that the US CDC has offered with respect to the duration of quarantine. Is that right?
I'm referencing the press release we got from the governor's office.
Oh, okay. Well, so there's a couple of moving pieces here, but in general, quarantine has traditionally been a 14-day period. The US CDC just in the last couple of hours, 12 hours maybe, has offered some new guidance about different approaches to quarantine in light of data that they've been collecting and analysis that they've been providing. So it really isn't something we can speculate on right now. It's something that our epidemiologists at the Maine CDC will make a determination on after reviewing both any test results, as we would with anybody, as well as the latest CDC guidance.
And I'm following whatever advice my medical provider gives me.
And Dustin, this is a minor thing, but I just wanted to be really clear. A PCR test is not a rapid test. A PCR test is the more traditional laboratory test that occurs at a reference laboratory like the Maine CDC lab or the hospital laboratories. It is not a rapid test. Going to turn things over to Ashley at WAGM.
Hi, Dr. Shah. A hospital in our area says they are experiencing an increase in community transmission. Can you explain what that means and what designates the community transmission label?
Sure. Let's first start, Ashley, with what community transmission is. Earlier on, very, very early on in the pandemic, with a high degree of certainty, epidemiologists in Maine and across the country were able to determine where somebody may have been exposed to COVID-19. They were able to go upstream and say, we have an understanding of who you were in contact with who was positive. That gives us a high degree of certainty as to from whom you got COVID-19 from. But across the country, as well as in some counties in Maine, people were starting to show up, and we as epidemiologists were not able to identify a person or event that they may have been to where it was clear that that COVID-19 was transmitted. That is what's labeled as community transmission. Think about it the way you would the common cold or influenza. Is there a clarity from whom you got the cold from or the flu? Sometimes there is, but not all the time. Sometimes a lot of us just get a cold and we don't recall having been in the same room or in contact with somebody who had a cold at the time. When it gets to that level of transmission, that's what we call community transmission. Community transmission is occurring in every county of Maine with varying degrees of intensity. Early on, the question was if community transmission was occurring. Now the question is to what degree of intensity is it occurring all across Maine? Going to turn things over to Allison at WMTW.
Hi, Dr. Shah. Thanks so much for taking my question. So just one question today. We heard the lineup of who's expected to get the vaccine first, and I believe here in Maine, it's healthcare workers, that category. But within that first category of that group of people getting that vaccine first, how are we prioritizing who's actually getting the vaccine? Because I don't believe we would have enough for every single healthcare worker. So how do we decide which doctors or which nurses?
Great. I'll start this, but please, Governor and Commissioner, weigh in as well. Allison, this was a topic that was discussed extensively yesterday at CDC's advisory committee meeting. And it's something that my counterparts and I have discussed as well. The general principle that the US CDC, as well as a separate panel convened by the National Academy of Sciences, both expert panels have recommended that finer distinction, that planning within that priority group, be made on the basis of risk of exposure. All healthcare workers are critical. All healthcare workers have a vital role to play. But different healthcare workers have different likelihoods and risks of exposure as part of their jobs. For example, individuals who work in the emergency department may have a higher risk of exposure. Individual healthcare workers who are around patients where procedures are being done that could generate the droplets and the aerosols that we know that transmit COVID-19 are at a higher risk of exposure. This might include, for example, healthcare workers who work in the ICU or on COVID positive units, which sadly are a commonplace thing in hospitals now. Those are the groups that the US CDC and the National Academy of Science recommend among healthcare workers be prioritized or start looking to be getting the vaccine first. And again, I think that makes sense. I think it's a common sense thing. We want to keep those healthcare workers safe for their own personal safety, as well as safe so they can continue taking care of patients.
Yeah, let me add that we're all talking about as well, how can we most effectively get each kind of vaccine out there to the highest risk population as soon as possible? There are differences between the Pfizer vaccine and the Moderna vaccine in its distribution, in its storage, and in the quantities and packets that'll be supplied. So we're looking at all those things too. See how we can get the biggest bang for our buck.
Going to turn things over now to Joel Waller at the Press Herald.
Yes, hi. Just a quick clarifying question first. So if under previously, before the US CDC came out with their new latest recommendations on when you can leave quarantine, under previous rules, even if Governor Mills or somebody else gets a test and it comes back negative, you're still supposed to stay quarantined for the full 14 days. Was that right?
You are correct, Joe.
Okay. And so any changes to that would just be based upon whether the Maine CDC, Governor Mills healthcare provider, et cetera, it wants to follow these brand new recommendations.
That's also correct, Joe. The new recommendations are based on a wealth of scientific evidence, as well as the experience in some other countries, European countries, that have used a model that allows an individual who has tested negative to leave quarantine sooner. We are evaluating the CDC's data as well as their guidelines. Our medical epidemiologists are evaluating those. And if we end up changing our guidelines, we will let everybody know.
Okay, thank you. And so my main questions are, so I heard it referenced earlier, I believe by Governor Mills, about how the initial vaccine distribution was less than what you were anticipating. Can you describe what you were originally anticipating and why you think it may be different? If you could just explain that a little bit more. And then I do have one follow-up. Thank you.
Well, let me just say my calls with the White House and the COVID-19 task force, the White House task force, they've always said they were going to make the initial distributions based on population. So we took our percentage of the whole population of the country and divided that by what we thought the gross dosages would be going out the door, and came up with a lot higher figure than what we apparently are being allocated initially, as did other states. So what I was told on the phone was that they took the population, they did a pro rata based on the population of each state of those over the age of 18. If that makes a difference, that may make a difference, I don't know. And then divided that by the percentage of which your state is part of the entire population of well over 300 million people. We still haven't quite figured out how they got to 12,600 and something, but we're waiting for answers.
Okay, thanks. And my follow-up question is just, Governor Mills, if you could kind of describe what your reaction has been to being exposed, and has it been unsettling at all, and what your thoughts are about your own safety and that of somebody that you work closely with.
Well, first of all, I have the highest degree of respect for all the members of the EPU, the Executive Protection Unit. They are members of the state police, very well trained, very professional, and have a high degree of ethics as well. I trust them, and I trust my staff and my cabinet as well. To be honest, there isn't that much change in my life because I've basically been in a bubble since early March, with very limited, in terms of what my normal schedule would be. I would be going out to events and giving speeches. I would be cutting ribbons and going to Grange halls and Legion halls and parades and all the things that we usually do. But my life, like the lives of everybody else in Maine, has changed substantially. And I drew back in March. When I'm in the office, I usually am in the office at the State House. There's a line around my desk of 6 feet. There is a sort of a duct tape moat that security put out there. So nobody coming in my office comes any closer to me than that line. And I barely leave my desk during the day when I am there. And we have certain finite number of staff people who come into the office, many people still working from home. So my exposure hasn't been that great to begin with. And we have gotten so used to doing cabinet calls and whatnot by Zoom. And I've had no contact, no personal meetings with any legislators or other public officials in quite some time. So I've been in a bubble anyway, just a little tighter bubble right now.
Hey, Joe, could I just add something on to what the governor said? this is a scientific point. The notion, we use the word exposed or exposure, and in some people's minds, that could conjure up a notion of contact without face coverings. And I just wanted to be really clear about the definition from the Maine CDC side of what constitutes an exposure. If you were within that close contact period of somebody, even if face coverings were worn, which in this case, as Governor Mills has noted, they were, that still constitutes an exposure.
Yeah.
Even the wearing of a face covering does not erase the fact that you were within somebody for at least 15 minutes for 6 feet. So I don't want to leave anyone with the impression that if you had a face covering on, there couldn't have been an exposure. And because there was one, it must mean that face coverings weren't worn. Not suggesting you were saying that, Joe. I just wanted to be ultra clear on what the definition of an exposure and a close contact are, even if you've got a mask on.
Although wearing the mask does diminish the risk substantially.
Definitely diminishes the risk substantially, no question about that. The science is very clear on that, but just wanted to be really clear on that, Joe. Going to turn things over to Blair at WGME.
Hi, good afternoon. So my questions are regarding the vaccine distribution. So once the vaccine is available, how long do you project that it will take until the everyday person who falls into stage 4 will be able to get vaccinated?
According, Blair, to the US CDC, that process where folks who are otherwise healthy and not as part of one of the priority groups, i.e. healthcare workers, individuals with serious medical conditions, individuals who work in congregate care settings, those are the priority groups. The US CDC and Dr. Fauci have both indicated that it may well be into the summer of 2021, late spring, early summer of 2021, before there is sufficient quantity of vaccine available for folks who are everyday Maine people, but to get the vaccine.
Okay, and I just have 2 quick follow-up questions for colleagues of mine. You touched on it briefly today, but could you explain a little bit more about the new guidelines for quarantining that the CDC released this morning?
Sure. We are evaluating those guidelines. We were given a briefing on them last week when they were in draft form. And as you noted, Blair, they have released them now. Our medical epidemiologists are reviewing them. The guidelines contemplate 2 scenarios, both of which are related to quarantine. I mentioned this at the top, but for completeness, again, quarantine is the period of somebody who has been exposed or could have been exposed, where they are asked to remain away from others just to be safe. The US CDC has studied a lot of data, plus the experience in other countries, as well as models of COVID-19, and have come up with and have devised 2 alternative strategies. One strategy is one in which testing is available. Under that strategy, somebody could, on anywhere from day 5 to 7, after they've been exposed, be tested. And if they receive a negative test, exit their quarantine period sooner rather than the full 14 days. Alternatively, if a test is not available, the US CDC has also studied the percentage of people who go on to develop symptoms not at day 10, but on days 11, 12, 13, 14, at the tail end of what was previously the 2-week period. And they found that it's a very, very small percentage of people. So they are also providing guidance now that recommends that states can, after reevaluate it, also shorten the quarantine period for people who have not received a test. Again, our medical epidemiologists are reviewing that finalized guidance literally as we speak today. We're going to meet, confer, and discuss what's best for Maine.
I might add.
Oh, yep.
I might add that it's a little different scenario when we talk about quarantining in the context of our travel advisories, because there we say either quarantine when you come to Maine for 14 days or get a negative test within 72 hours of coming here. So that's still in effect right now. If you get a negative test within that time period, we have said it's okay. These are for people who aren't symptomatic, who have not had exposure, normal travelers. So it's a little different scenario.
And Blair, I don't want, I hate to be super repetitive, but the terms matter. This guidance is for individuals in quarantine who have been exposed, potentially exposed, but do not have COVID. If they've got positive confirmed COVID, that's isolation. That's a different set of criteria. Those criteria have not changed.
Okay, thank you. And just lastly, Maine high school winter sports are supposed to begin on Monday with skills and drills. Is that still on target, or will there be a delay?
So we always are looking at our guidance, but we have nothing new to report at this time.
Okay, thank you.
Going to turn now to Charlie at the BDN.
Yeah, hi, Dr. Shah and Governor Mills. I have one kind of just quick clarifying question and then two questions for the governor. The clarifying one is about the Pfizer vaccine. When the governor said that there were something 12,000 something doses, just to be sure, does that translate to 6,000 something people getting the vaccine because it has to be administered twice?
Oh, good question. And we did clarify that. I clarified it the other day on my call, and I think Dr. Shah's clarified it with his sources too. And it means 12,600, et cetera, some odd people. It's not, it's the first dose of a 2-dose regimen. So it would be enough to cover the first dose for 12,600 and something people. I think that's correct.
And Charlie, what they've indicated is that they will hold the second dose in reserve for us. So from a planning perspective, it allows us to plan for 12,675 people. We are, how do I put this? That's what we have been told. Things have been changing a lot lately, and the proof will be in the pudding.
Okay.
I did ask that specific question. I know the answer I got on Monday. So that's all I know.
Okay. And then, so for the governor, sort of two separate questions about your exposure to the person with COVID. I guess the first is, have you been near or somehow exposed to that same person in previous days? I know that you said the actual exposure was Saturday, but were there any other possible exposures before that?
Not in recent days, no. They rotate in and out, you know.
And then it sounded like you were kind of addressing it earlier when you were talking about the spacing in your office. But my other question is then, have any other staffers or people, are any other staffers or people who have been around you quarantining or around that other person quarantining? And can you say how big that web is?
Well, first of all, I have not tested positive. So people who have been, quote, around me would have no reason to quarantine. People who work with me in my office take precautions routinely. None of them has had symptoms or tested positive for COVID-19, and none of them has been, within 6 feet of me, and they all wear masks. So there's no need for any other people quarantining at this time. And I can't tell you about the individual who tested positive, what they're doing. But.
Okay, thank you.
I'm going to turn now to Amy Brown at WERU.
Thank you, Dr. Shah. This first question, I think, is primarily for you. I think Governor Mills may want to weigh in, and it starts off political, which I know you don't like, but it gets more epidemiological as it goes on. The Maine GOP chair has issued a statement, came right on the heels of the statement from the governor's office yesterday, calling out the governor for the safety measures that she put in place in the state and saying that she has potentially risked spreading COVID-19 to the Maine legislature. And quote, "We call on Janet Mills to immediately provide additional information to the public so the public can understand who may be impacted and if proper protocols were taken," end quote. Given that the governor hasn't been tested yet and immediately put out a public statement saying that she was quarantining and going to be tested, is there anything else the public needs to know at this point that hasn't already been disclosed?
Yeah, I saw that statement and I scratched my head about it, because one of the very reasons that I made a statement last night was because I was scheduled to swear in the entire legislature this morning, not close up, mind you, but in the big auditorium of the Augusta Civic Center. And I had to tell them I regretfully could not do it. And the acting Chief Justice of the Maine Supreme Court did it instead. So I have had no contact with legislators, not even from 50 feet away. And I've had very few personal meetings, held very few personal meetings with anybody the last 9 months, frankly. So there's no reason to believe that I have put any legislators at risk. Again, in terms of the risk analysis, I think I've explained, even in my office where there's a handful of staff people who come in and others work from home, they keep their distance from me. They wear masks. They wash their hands. We have sanitizer all over the office. They clean and sanitize their own desks and doorknobs and such like. And I think we've done a pretty good job that way.
And I will just add that this has never been about politics. It has always been about public health. We appreciate that the governor has been transparent about her own exposure in her quarantine. Again, it's to, in part, remind people that it could affect us all. But we do ask people to let our public health officials to do their job.
And Dr. Shah, there's nothing else that you feel like the public needs to know in order to protect safety?
I think, as Commissioner Lambrew mentioned, but I'll say it again, this is a reminder that the virus is everywhere and that the precautions we talk about, they're not for other people, they're not for others, they're not for the people in another town, they're not for people in another county, they really are for each and every one of us.
Okay, thank you. And my second question is, once a certain percentage of people get the first dose of the vaccine, will life be able to start getting back to normal, or does that have to wait until after the second dose? Does the first dose offer any protection?
Back to normal for that individual, you mean? Or?
Well, I'm thinking like in workplaces, working more closely together, or being able to go into stores without masks. Or...
The answer, Amy, is that it is not known, although based on the early data, the maximum effectiveness of the vaccine kicks in after 2 doses. The FDA, as well as the scientists who study the trials in which the vaccines are done, are looking for signs that there was sufficient efficacy after 1 dose. That analysis is underway right now, but every briefing that I've had with a vaccine expert or an immunologist, they've all been uniformly clear that based on the evidence as we know it right now, both doses will be necessary.
Great, thank you.
I'm going to turn now to Bob Evans.
Good afternoon. Governor, there's a growing concern from businesses about the 9 p.m. curfew that is in place and how that may impact this year's New Year's Eve celebrations. Just wondering, has there been any discussion surrounding an exception for that night?
We have not talked about New Year's Eve. Honestly, we haven't gotten to New Year's Eve yet in our discussions. It was the furthest thing from my mind. You know, unfortunately, it's a double-edged sword. A lot of people like to party on New Year's Eve, but this may not be the year to party because there'll be an uninvited guest under the mistletoe and maybe a deadly guest. And I'd hate to see parties turn into funerals and hospitalizations and people on vents, people in the ICU. The numbers that Dr. Shah just recited a few minutes ago are not happy numbers. We're better than most states. We're on a par or not quite as good as Vermont sometimes Hawaii, but we're trying to keep this genie in the bottle because once it comes out, you can't get it back in. And the numbers in the last several weeks have been disappointing. And it means that there is community spread that is extremely hard to control. Only the people of Maine have the opportunity, have the ability and the responsibility to control it by not going to parties, whether I say you should or not, just don't do it. You know, whether there's an executive order that closes things at 8, 9, 10, or 11 or midnight, doesn't matter, just don't do it. You know, this is your personal responsibility, your social responsibility to keep these numbers in check, to keep your loved ones and family and neighbors healthy. because people are losing their lives. And we all have that responsibility, no matter what any governor says or does, or what any executive order says or does.
Understood. Commissioner Lambrew, how much money did Maine get from the CARES Act, and how much is left, and what are the plans for it? Actually, the governor may want to weigh in as well.
Yeah, that's sort of a question for Commissioner Figueroa, because you're talking about the CRF funds. We go over that routinely and try to see where we're at. We're under pressure to push out the remaining funds, whatever there is left. We've spent a lot, and it's on our website, the actual breakdown. We spent a lot to replenish the unemployment trust fund so that those taxes don't go up. We spent a lot on schools, over $300 million on schools, helping them in various ways be able to stay open and stay safe. And we have used a lot of those funds to help with healthcare workers and first responders and public safety individuals, to help with hazard pay in some areas and corrections and whatnot. So there's a great variety of things that we have used it for. And we use it for testing, of course, and PPE to a large extent. I can't tell you the exact number of dollars that are left, but we're under pressure to spend every dollar before December 30th, according to the current Secretary of the Treasury, Mr. Mnuchin. All those monies will be subject to audit and have to be out the door, expended before December 30. So if I had my druthers, the unemployment checks would continue into January, into the cold weather months when jobs tend to go to, job availability tends to go down anyway. If I had my druthers, I continue the rental assistance program that we've used that money for, continue that into the cold weather months and help people with heating and rent and whatnot, and continue to help with food supplies through the 250 odd food banks and elsewhere across the state after the holidays, when food supplies do tend to dwindle and get pretty scarce.
Understood.
Yeah, I'll just add very quickly, we are excited though as part of this to open two new opportunities. One is for healthcare providers, hospitals, nursing facilities, large behavioral health providers, et cetera, who haven't previously gotten relief. That application portal is open until December 10th. We also announced one for hospitality, restaurants, bars, other businesses, particularly hard hit by COVID-19. Because of the power outages in Maine yesterday, we delayed the start of that application process to today, but we're really excited to be able to, in these last days of the availability of this funding, help those sectors really hardest hit by COVID-19.
Dr. Shah, I'd hate to leave you out, so I have one quick one for you. In yesterday's report, there were 10 people listed from Androscoggin County who died, but I know some of those were reported with a delay due to the holiday weekend. But is there any connection in the 10 people in Androscoggin County?
Yep, Bob, we've been looking into that. We're not aware of any unifying theme amongst those individuals. What we have seen across the state of Maine is a number of individuals have passed away because they were part of outbreaks that have been occurring in, say, long-term care facilities. But no, there wasn't a single unifying theme there. It's also, this is a data-related note, but I'll just mention it really quickly. I'm going to say this, but please know it does not diminish the agony and the anguish surrounding these deaths. But these are reports of individuals that Maine CDC has received. Their date of death may have been in the 72 or 96 or 100 plus hours before they were reported to Maine CDC. It wasn't all within the preceding day, but again, that doesn't discount the agony and the anguish of their deaths and the impact it has on their family, but it wasn't all within a single 24-hour period.
Thank you.
I'm going to turn things over to Ross at the Maine Monitor.
Hi, thank you for taking my question today. So Somerset County now has the second highest death rate per capita in the state, behind Waldo County, which had most of its deaths early in the pandemic. Can you say a little bit about what might have contributed to Somerset's rising death rate, and what, if anything, this tells us about how COVID-19 is spreading throughout the state?
Sure, Ross, very similar in keeping with the spirit of Bob's question as well. We have taken a deeper look into those sad facts. What we found in Somerset is many of the individuals who have died with COVID-19 have not been residents of nursing homes or other community living centers. In fact, many of them were individuals who passed away and were community members, but not associated with congregate living. And so we are looking more deeply into that to try to determine whether there are other unifying factors, whether there is, for example, just in a demographic sense, an older than average age in certain counties, and whether that could be generating more individuals dying. We've got one of our junior epidemiologists trying to take a deeper look at that. And I want to apologize. I misread my paper. I called you Ross, not Rose. My apologies.
No problem. Thank you.
Going to turn over to Patty White at Maine Public.
Thanks, Dr. Shah. With the recommendation from the US CDC to move nursing home residents and staff into the very top priority tier for a vaccine, is Maine now going to bump up this group to the front of the line from phase 1B to 1A? And if so, who would get priority, given that we aren't going to have enough doses for everyone in that first batch?
Yep, this was a topic of discussion. It has been for the last 18 hours. Governor, do you want me to kick that one off, or?
Sure. I mean, it's all a matter of numbers, Patty. We want to be sure on how much of the vaccine we're going to get. Makes a difference if we're talking about 6,000 people or 12,600 people. Obviously, we think we have clarity on that, but that's sort of a basic number to have. And then again, the different variables, logistical concerns about how the vaccine may be transported, getting it out to nursing homes versus getting it out to other facilities such as larger hospitals. Those are the things that are under discussion right now.
Patty, again, just to pick up on where the governor mentioned or left off, it's under discussion. Our current thinking is we're balancing a number of variables, one of which is that nursing homes across the country, as well as in Maine, have been areas where there have been a high number of cases, a high number of outbreaks, a high number of hospitalizations, as well, sadly, as a high number of deaths. So we want to start focusing on them, but we also recognize that keeping healthcare workers safe, particularly hospital-based healthcare workers who are taking care of those patients who are transferred from nursing homes, is equally critical. I think our approach in general is going to be to start moving on both tracks in parallel, but use risk as our guiding principle. Again, not all healthcare workers have the same risk of exposure, and not all, say, long-term care facilities have the same baseline risk of having COVID. Right now, we're trying to determine whether we can figure out those employees in which hospitals, as well as nursing homes that have higher risk, and start our processes there.
With the higher risk, would that be tied at all to geography in terms of, higher case rates?
It could be a function of community transmission rates, as well as the composition of who's working in them. We're also working and talking with colleagues across the country to see how they are operationalizing these twin goals of long-term care facility residents and staff, as well as healthcare providers, for example, those in hospitals. We're trying to get a better sense of how to operationalize both at once. There's also timing considerations. I won't go into that too much now, but the mechanism under which nursing home residents will be vaccinated in partnership with pharmacies has some very unique timing elements that we're also taking into account as well.
Okay, thanks.
But the bottom line, Patty, is simply how can we get the most number of vaccines, most doses of vaccines out the door as quickly as possible to the highest risk people in our state as efficiently and fast as possible, the bottom line.
Got it. If I could ask one other question, actually, it's a few quick questions just about the vaccines. So did we ask for 36,000 doses of the Pfizer vaccine? And then when can we place another order? And have we placed orders for the other, like Moderna?
Patty, I'll start and then again open it up to others. But you used an interesting verb there, ask, and there hasn't been much asking. We have been informed about what our allocation will be. And even though our federal colleagues use words like order, what that really means is just providing them the addresses for where we would like them to ship the vaccine, where we pre-identified ultra cold storage sites. So it hasn't been asking as much as it has been planning for what we are told we will receive.
If we're going to ask, Patty, we'd ask for 2.6 million doses right now. Find a place to put them. But
you were expecting 36,000.
Well, based on the estimates, based on population of what we were told, the entire distribution was going to be nationally, the first initial distribution.
And for a brief period, that was the number that appeared on the dashboard that we, where Operation Warp Speed reports our allocation to us. It then dropped. We're starting to ask harder questions. First of all, chief among them, what happened? And specifically with respect to Maine, did any state get what they were initially told, or even more than that, i.e. is Maine getting shortchanged? And then of course, is the theory then that the initial allocation will be smaller, but the allocations will be more frequent, such that in the end it will be the same? If so, then why did that change? Either way, we want to make sure we have all the facts, and we're asking those hard questions.
And I will just say, when I brought the question up on Monday's call with the White House task force, other governors then chimed in with the same questions. They wanted to know, is anybody else getting shortchanged? Is one state getting favorable treatment over another? Vice President Pence and others reassured us that this was all based on a rational pro rata formula.
Thank you.
And the final question for the afternoon goes to Patrick Whittle.
Thank you very much to all three of you. I have a couple of questions. The first for Governor Mills, the members of the Republican Party have said that they would like to see the emergency declaration rescinded sometime soon, and sort of a change in approach to policy about the state's handling of the pandemic. They've also asked for a little bit more information about your own exposure to the virus. Do you have any responses to those questions?
I don't think they've asked me for any such information. Have they asked you for information from me about my contact? Or I'm not sure what you're saying.
The state party sent out a statement yesterday saying that they feel they need more information from you about your own. I don't want to call it a case because it's not a case yet. That's why I'm fumbling around the language here. But they said yesterday that the state is in need of a little bit more information from you about if any members of the legislature were exposed, or any members of your staff or anything like that.
Okay, thanks for the clarification. And I think I've answered that. Clearly not. Nobody's been exposed to anything. And I had close contact. I have not tested positive, but I have not had any personal contact with legislators. I would have had distant contact with them had I gone to the Civic Center and sworn them in this morning. But since I'm in quarantine, I did not do that. And in terms of any other contact, there has been none. My staff, as I said, the small number of staff people who come to the State House office keep their distance. They wear masks. They wash their hands frequently and use hand sanitizer. So there's been no other quote unquote exposure.
Patrick, and Governor, I know you said this, but Patrick, the governor is in quarantine. She is not a COVID-19 case. And so to talk about contacts of a contact, that's not an epidemiological phenomenon. And so we really got to move away. We got to stick with the science here. And, so it's all of that ground has been tread, Patrick, but you just wanted to put that on the record.
And, we've tried from day one to make sure, and everybody understands, I think, this pandemic is not a political issue. It should not be politicized. We're focusing on the health and safety of all Maine people, whatever party, whatever profession, whatever region of the state they live in. That's our sole focus.
Great. And regarding the emergency order, it was just renewed relatively recently. I'm assuming
the declaration of a state of civil emergency. Yes. What about it? Do they want me to rescind it? I'm not sure what they're asking.
They're essentially asking for a chance to provide more public input into it, and they would like more legislative involvement in the process, is what they said yesterday.
Okay, I didn't know that, but I mean, they're welcome to contact my office, and if they feel that there's no longer an emergency, I'd be happy to hear the evidence if they have factual evidence to that effect. The fact is that nearly every one of the 50 governors has done the same as I have done, Republicans and Democrats. The fact is, if we didn't have a proclamation of a state of civil emergency, we would forfeit significant federal help, federal financial assistance, and the coordination that we've had with other states. I'm not about to forfeit that. And I'm not about to let the people of Maine down by pretending that there is no emergency ongoing, because there is. Just listen to the numbers that Dr. Shah has recited.
Great. I know this is kind of a lengthy call, but I do have one more. I'm wondering where we are, Dr. Shah, with respect to gloves, gowns, respirator masks, N95s, and so on, because we're seeing around the country that the stockpiles are either low, or there are some states where they're the wrong size, they're too large for most female healthcare workers, and so on. And I would love to know where Maine stands in regard to that.
Absolutely, Patrick. We will get you the latest inventory counts for all of the PPE that we have, as well as what we have shipped out as well, which I'm proud to say is now in the multiple millions of pieces of PPE. I won't recite all of the PPE inventory numbers for a number of reasons, but we will get those to you ASAP. I get a report on them every single day. And I will say, Patrick, you're right. Nationwide, we have seen reports of concerns about supply of PPE. We have spent months making sure that we can not only satisfy the current needs that healthcare providers have of PPE, but also ensure that we're building up a stockpile so we could satisfy future needs as well. That process has not stopped one bit. And we'll get you the current numbers of everything.
Okay, those would be great to have. Thank you very much.
You bet. Thanks, Patrick. Governor, Patrick's question rounded us out for the afternoon, so I'll turn it back over to you, Governor.
Thank you. Thank you. It's been a long afternoon, and we're busy as always doing the regular work that we do. And I just want to stop for a moment and again express my condolences to the family, friends, and community members of those 24 additional people who've lost their lives, who've died with COVID-19 in recent days. My heart goes out to them. It really does. And in terms of immediate needs, I want to again express my appreciation to Senator King and Senator Collins and the 4 members of our congressional delegation. They are working hard to bring the U.S. Senate in particular together behind a package. There isn't a governor in this country that doesn't believe that more financial assistance from the federal government is absolutely critical. As we go into the winter months, we're going to need funds to help train and pay for vaccinators, people to administer the vaccine. We're going to need money surrounding the vaccination distribution itself, and funds for economic recovery, more PPE probably, and more testing. We're running out of testing supplies. We don't know what's going to happen after December 31st. These are all vital issues, not to mention the schools and their needs, and the small businesses that are right on the cusp right now, even with the holiday season. So please, for the rest of it, do your part to keep those businesses open. Shop locally, shop small businesses, and shop by internet or mail or phone when you can, but shop locally. And please keep your distance, wear a mask, and wash your hands. Thank you so much.
Thank you, Governor. Thank you all for spending time with us this afternoon. Have a good afternoon. We'll talk again soon.